Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Bethany Heidemann, who's an advanced registered nurse practitioner. Bethany has been in aesthetic medicine for over 6 years. She graduated from the University of Iowa with her BSN in 2005 and from Chamberlain College of Nursing in 2017 with her MSN to become a nurse practitioner. Bethany's past experiences in nursing and as a nurse practitioner ignited her passion to care for patients in a comprehensive and individualized manner, not a one-size-fits-all way. She's a true believer that looking good and feeling good comes from a combination of taking care of yourself from the inside out. She's brought on several services to her clinic that focus on improving overall quality of life, which in turn makes you feel like a better version of yourself. And we're going to talk about those services today. So, welcome to the show, Bethany.
Thank you for having me.
Well, I always like speaking to other female entrepreneurs, especially nurse practitioners. And we have definitely taken the road less traveled because we're a female nurse practitioner in private practice. So tell me your story. How did you get into aesthetics, into private practice? And then we'll get into all the body contouring devices and services that you have added on. But tell me your story. How'd you get started?
Yeah, absolutely. So I was blessed to work with the best as far as from a surgeon standpoint as my mentor when I first started out in as a nurse practitioner, I should say. So I was in ears, nose, and throat at the time. And he actually had a practice in a different city, and I worked at a satellite clinic, and I was able to provide care independently to patients, and then obviously have his support and collaborate with him on surgeries. And so I just really loved that side of being independent and that side of getting to help a patient with their main concern and treating them individually to get to that ultimate goal and outcome. And so I realized that is what I loved about being a nurse and a nurse practitioner. And so I just truly knew that that's kind of what I needed for the rest of my career and my life, I guess I should say. So when I really started looking into what that looked like for my future, he is about 25 years older than me. He at the time was in private practice. And so I was very much aware that the grass is not always greener on the other side in healthcare, and I might need to see what else was out there. So at that time, probably about early 2018, somebody maybe sparked my interest a little bit in aesthetics. I can't remember exactly how that came about, but they said, you could do this on your own in Iowa. And so I started just digging into it. I literally just got a card table out one day in my living room and grabbed my laptop and started
Mhm.
searching, what can I do? And had a really good friend who owned a chiropractor office not too far from my home. And so I rented a 10 by 12 room from him, stayed
Mhm.
in ears, nose, and throat, worked when I could on the aesthetic side of things, but mostly still full time in ENT. And then really realized over the first 6 months with just a few very small footprint procedures that I was doing that there was a need and there was a want in our area. And so I just really dove into basically what do the patients want? What do they need? What are their goals? And so as I went, I started researching more procedures that I could offer and then realized I really needed to have another provider with me. So about late 2019-ish, still working in ears, nose, and throat at the time, but kind of restructuring my hours as I went to do both. I got in talks with an esthetician to bring her on because I truly believe it's not just what I can do from a nurse practitioner standpoint, but it's truly just getting their whole canvas to look good,
Mhm.
help them feel healthy in that regard. And so the maintenance side of things with an esthetician was super important to me. And so in early 2020, I was ready to hire her. I had a building all set to go, and then I was closed for 9 weeks for COVID. And then it just kind of transpired from there. So it was definitely built on a passion to keep caring for people on an individualized basis. And this is kind of where I got brought to, I guess.
Yeah, I had humble beginnings as well, but they make for great stories. I mean, like
Absolutely.
now I feel like we've arrived, right? We have this beautiful clinic, we provide these services, but that's not how it started. It was a lot of blood, sweat, and tears and team
100%.
members, right? Like we both recognize we cannot do this alone. We need the team, right? We
We
can direct the
absolutely do.
ship, but like we need all the sailors, like we need everyone on the team to keep the ship afloat,
100%.
literally. So how do you decide what treatments are best for your patients?
Yeah, the very first thing, and I think I always lean on the fact that I am a nurse practitioner first and that aesthetics is medicine. And so when a patient walks in and they basically give me we'll call it their concern, but their chief complaint, I mean, that's what I really look at it as. And they guide me. I just really look at them and I say, why now? Why, like, what brings you here now? Like, what is your time frame? What is your goal? What is your budget? I mean, we have to talk
Yeah,
about that.
yeah.
This is out of
Yep.
pocket services. And so in that regard, I basically let them guide me. One of the things I tell every single patient when they walk in during a consultation is one, it's 100% not one size fits all. And most of my patients are in the 30 to, let's say, 60-year-old female demographic. That's
Yep.
pretty much
Yep.
what we have here.
Yep.
And pretty much all of them can mark the same 10 things as their chief complaints. But we're all starting at a different point. People have
Mhm.
already done things, they've never done things, they have a different time frame, they have a different budget. One of my favorite stories was I asked that question of why now? Like, what brings you here? And a gal just goes, it's the first time in the past 20 years I was in a not healthy relationship. I'm getting divorced and it's time for me. And I have my hearing for my divorce and my custody and all the things coming up. And I'm going to do this for me and I want to look good and I want to feel good. So we had kind of a time frame, like a quick time frame, but that really guided me in what I could offer in that moment because some things do show quicker results and some things take a while. And combinations and all the things. So I guess that's how I decide. They lead me, they like guide me into that. And that's the best part about what I do because it's never the same thing. And just looking at something on paper is the least of it because they truly once they start talking you just start diving into like what's truly important to them. um Another thing that I always notice is like what they do for products, right? Because skincare is huge and we talk about that all the time. And if they have one thing listed or nothing, when I say what do you do for your skincare and they're like nothing, that really opens my eyes to, well, I'm not going to send you home with 15 things because one, how are we going to know if they're working? And two, that's going to be super overwhelming and they're never going to do it. Even if they think, oh, well, she's the expert, she's recommending it, I'm going to do it. They're not. So the last thing I want to do is overwhelm them. So I think, yeah, just being guided by them was kind of the biggest part of that.
So you listen is what you're saying. Now, what if, so
Yes.
what if they ask you, like, okay, what do I do about these nasolabial folds? Like, what if they ask you?
Yeah, for sure. So well, the main thing that I do in that regard is I explain why those are there. And that, we all have them, babies have them. They just have really good tissue to like
Hmm.
hold everything up, right? So we just talk about how you get either rid of them or at least support them.
Hmm.
So we talk kind of well, we always talk from like I say the ground up. So it's like literally like the bone and the muscles and the tissues and all of the things and then how that all comes about. The last thing I know there's different theories out there and every provider has a different way that they recommend treatment, but the last thing I want to do for a patient is truly recommend just filling in where those deficits are because I don't necessarily feel that gives them the most natural result or a really long standing result, to be totally honest. And that's something that we really strive for here is just bringing out your natural beauty and bringing out
Mm,
the best version of you, I guess, is what we talk about a lot. And
love
so,
that. Yeah.
so I really, again, just kind of guide them on really why, or educate them, I should say. So listen and educate.
Yeah, yeah, yeah. That's good. Well,
Yeah,
can you
yeah,
further break that down, educate our audience? I love how you said you start from the ground up. So can you talk just briefly about, so even you could even talk in regards to what I was just asking about, but like
yeah.
talk about that. Talk about the structure of the face and muscle tone and which is going to lead us into these devices we're next
Yeah,
going to get
for
to. So
sure.
yeah, yeah.
Absolutely. Yep. So, as far as that goes, what I always talk about is it even starts from the bone. And I don't have any specific treatments necessarily that are augmenting the bone, although we can use some fillers and things like that to
Sure.
get to that area, that space. But it deteriorates. Like everything kind of changes over time. And so then the muscle starts to slip, right? And the tissues, they just aren't the best quality as we have more birthdays is my favorite thing to say. And so with that being said, we just talk about how, things start to head south a little bit and we need to build up, but just starting on the surface is not going to do that. So I have to really think about the support under the surface
Yeah.
from the bone standpoint, the muscle standpoint, the tissues, and then we start talking about the quality of the skin. However, the quality of the skin also is super important. And so if somebody is either on a budget or a time frame or just can only do one thing at a time or whatever it is, we always talk about that canvas because if that skin doesn't look good, then nothing else I pump you full of or lift up or do anything with is going to look good. So we chat definitely about the skin health from a product and a procedure standpoint along with. So it's not just a one thing, it's usually a combination to get that best result. So that's how we approach that.
That's good. And I hadn't previously planned on asking any questions about skincare, but now I realize I need to. So maybe we'll come back to that, but we'll stay
Okay,
on
so
stay
sounds
on face.
good.
So when you say everything starts to fall, just for the listeners, right? So I
Mhm.
want to explain to them. So like what's happening? We're losing fat, we're
Yep,
losing muscle. Our skin is
yep.
like literally sagging. So we're losing collagen and elastin. I don't work in aesthetics, so I'm just literally just like
Yeah,
make you give
right.
me pick
Yeah.
century.
So really, I mean, we don't necessarily, so in the face, like, and
Yeah.
we'll talk, I'm sure, about this in
Yeah,
upcoming
yeah.
comments, but with the muscle in the face, obviously, especially women, they don't want a bulkier face. Like we don't want to build up and make them strong in the face. In fact, we have procedures that debulk the face. So like we definitely don't want to like bulk it up. But what we do want to do is increase the relaxed muscle tone. So everything looks lifted, toned, and tightened. And so that's what we're thinking about when we think about the muscle. So not necessarily building it and making it stronger like we would want to with the body, but truly tightening it. Because if you tighten it on like a resting level, then it is going to hold everything else up better
Sure.
and give us more of that mid-face facial volume. And then we think about that. How does that it complements like the under eye area because it lifts the volume back up and then we don't have that light reflex under the eye and causing the dark circles and all the things that most women come into my clinic complaining about by the
Hmm.
time they hit 32 and beyond is when I start hearing those comments. And so, yeah, so it's just the general basics of like the anatomy and why it's happening. And
Hmm.
then we just discuss how we kind of combat that.
Can improve it, yes. Okay. So I would want
Sweet.
to ask about what procedures you utilize in your clinic to help with literally just that, with muscle strengthening of the face, but also the body. I think you probably
Yeah.
have like every single BTL device, and we're getting
We
there.
do.
We have quite a few of them now.
Yes,
So maybe
I
we'll
know. I saw that.
so maybe we'll break each of those down. You can start wherever you like. I'm just going to tick them off because I want to make sure we cover a lot of bases here. But um,
Yeah.
tell me kind of
Well,
what
I'll just
services
kind
or
of
maybe where you started. What was your
that was
first
just gonna say.
device? Yeah, yeah.
Yeah. Okay. So I should kind of give a little background in this because I do think it's important because when I first started my practice, it was all about the face. Like that's all I knew. Like it was just like
Right.
facial rejuvenation. I also am a pretty self-driven person when it comes to fitness and taking care of my body and all of
Aren't
the
you like a
things. And
marathon
so
runner or something? Are you like,
I am. In
yeah.
fact, I have one in less than 3 weeks.
Oh my gosh,
So
yay.
yes, I do. So with that being said, my patients also very much know that about me. So when I bring on equipment, I have to believe in it and I
Mm-hmm.
have to
Mm-hmm.
really have things that ring true to how I practice and what I believe. So when I was first approached by BTL, specifically for
Yeah.
probably other companies, but specifically BTL about body contouring, I quite frankly think I laughed in their face. Like, who am I to bring on a piece of equipment? Because this was my naive wrong thinking because I know very well now that it is not like this. But in my brain, I was thinking, I'm bringing on this piece of equipment that's just going to be this magic bullet, basically, to tell people they don't have to go to the gym and they're going to get stronger and they're going to get a six pack and all the things. And I'm like, I'm never going to be able to sell that, educate a patient on that because that is not what I believe.
Mm-hmm.
But reluctantly, somehow I think it was just the idea of going to Chicago. I was excited about that. So I was like, you know what? I'm going to go to this event and I'm going to learn about it. Well, I will tell you in 48 hours, my perspective changed immensely. I purchased the equipment at that event.
Mm-hmm.
And the way I practice and the way I take care of my patients has ultimately changed because of that decision in the best way possible. And
Yeah.
it's guided me to all the other purchases and all the other things that I have, as I call them, tools in my toolbox for my patients. I just really utilize them and I utilize a lot of them together. So, with that being said, the first two devices I purchased were the Emsculpt Neo and the Emsella.
Same
And
with us.
the
Yep. Just for listeners, same
yes,
with us. Yep.
absolutely. And the reason is because I was thinking more when I opened Spry, I put skin and wellness clinic because I was truly thinking of like, if we don't take care of ourselves from the inside out, then nothing on the outside really looks good anyway. And
Yep,
so
yep.
I really felt like that was my approach to the wellness side of it, is truly bringing on these pieces of equipment. And so when I first learned about them at the conference, what really changed my perspective on it was a couple of providers who had to spend the money to buy the equipment, had to get it to work for their patients. I mean, those are the people that really speak to me because they're doing what I need to
Hmm.
do.
Hmm.
They were talking about like truly life-changing results that they had for patients. And it wasn't the cosmetic results they were talking about, it was the quality of life results.
Hmm.
And I was like, oh, I have that postpartum mom. I have that person that just needs a little extra help to be a little stronger, to feel comfortable going into the gym. Like, I have those people. And so then that's how we approached it. I would definitely say trial and error a few times of really learning how we're going to get the best results for our patients with those devices. But what we have clung to and what we have really learned is if they are utilizing those devices for quality of life and for strength, we're going to hit it out of the park every single time. Down the road, we start to see the cosmetic results, but those don't happen overnight. The way the body works, that takes time. And so we really chat about that a lot. And there's a lot of factors, and I'm not with them outside of here. So we have to like approach like the cosmetic sides very realistically based on where the starting point is. But one of my favorite stories with Neo and Emsella
And let's
was
explain what those are too. I want
okay,
to hear that, but
yes, yeah,
let's set the
absolutely.
stage for that testimony
Yeah.
describing what technology each of those devices has, if you can.
Yeah, yeah, absolutely. So the Emsculpt Neo is a device that is specifically designed for the body. It uses energy from both heat and also magnetic energy to work on strengthening the muscle, as well as rebuilding collagen and elastin on the surface of the skin. So we're working on both the muscle for tightening and strength, as well as the skin to help rebuild and repair, and then tighten and lift in a sense as well, depending on the area that we're working on. So that, if, in a nutshell, is the Neo device. And then the Emsella device is actually working on the pelvic floor. And it, in my opinion, is one of my favorite devices because it truly is a game changer for patients. Because most women who have had enough birthdays, it doesn't even mean they've had enough or had babies, honestly, and men as well. But especially our demographic, like I said, is primarily female. And so for them, like over time, that pelvic floor just weakens. And so we start to notice we can't hold it as long before we go to the restroom, or we leak, or we have what we call stress incontinence when we
Mhm.
jump on a trampoline or jump rope or cough or sneeze or laugh, whatever it is. So we really need to focus on that pelvic floor. What we do often is combining the two treatments, because what I have learned, and this is a lot of stuff I just had to learn, like I said, through trial and error and just really experience, and listening to patients and what they need and where we're at. But a lot of times it's pairing the Neo with the Emsella to get the best results, because especially not to pick specifically on postpartum mamas, but or on the children that make us postpartum mamas, but they really do wreck our core. They just do, and they make life so great, but they also can definitely do a number on our pelvic floor and our core. But we really have to think about the support in the middle, but also lower. For some people, it does require a combination of the two to get the best results, because like I said, if we don't have the support from those abdominal muscles, then the pelvic floor is
Hmm.
only going to be repaired so much with just the Emsella chair. So we pair the two together.
And we call that,
Um,
we do as well, and we call that the core to floor. Although I was going to ask for your core to floor, do you primarily do abs M sculpt with the pelvic floor Emsella, or do you also do glutes, or what do you like to
that's
do?
a that's a really great question. I would say the true core to floor for us is the abs and the Emsella chair. That doesn't mean I haven't done the glutes as well. But typically speaking, from a true, like if a patient is coming in with urinary incontinence as their main concern, and I will tell you, there has been many times where that's their main concern, but then we ultimately end up needing or choosing to do the core to floor together, the abdominal treatment with the Neo as well. And that's all based on the assessment. I mean, truly, physical assessment, like me testing their muscles, and then also what they explain to me from their subjective side of it, like what they're going through and all of those things. And so, um, with that being said, typically, so core to floor to answer that question is typically the abs and the Emsella chair together.
Yep, yep.
We have in a couple of cases we have done glutes, but that is more. They had really good results with the core to floor, and then they want to do the glutes for more of a cosmetic result.
Sure, sure.
Um, Kind of back to one of my favorite stories
Yeah.
was a gal who she is well now a mom of teenagers, but at the time I think her kids were 8, 10, something like that. And she's actually somebody I knew outside of my practice prior 100% from working out together. We took the same fitness class, and so I knew this woman was
Yeah.
strong. I've
Yeah,
seen
yeah,
her
yeah.
work out, I
Yeah.
see her take care of herself. And so never once did I ever think to even consider talking to her about this device because I just didn't
She
think that
needed
she
it.
was
Yeah, yeah.
necessarily a candidate for it. And that's my own fault. I have learned to just, again, listen, right? And not assume. But with that being said, she was my patient previously for other things, just one service she would come in for every few months. And one time I was talking to her and we weren't working out at the same place anymore. And I just said, "What are you doing for your fitness?" And she was telling me. And then she started talking about this like horrible low back and hip pain that she had been having. And it had been going on for years. So even the times that we were working out together, she was having that. I just didn't know that. So she proceeded to tell me she had done everything: chiropractic, dry needling, massage therapy, acupuncture, occupational therapy, you name it, like everything. But she's like, "Bethany, like I literally can't even stand." I mean, and this woman, like I said, is a picture of health from the outside. She
Mm-hmm.
goes, "I can't even stand at my kitchen sink and do dishes without just being in excruciating pain. Like I just really hurt." And so we kind of started talking about that. And at that same time, she was there for another visit. A light bulb went off, and I was like, my first thought was, I need to strengthen your glutes. Like that's actually what I thought. This was in the very beginning when I first brought on Neo, and I was like, I just brought on this device. Like, do you care if I just try it on you? I just want to see how you do. And we did her glutes and just like one treatment just to kind of get a
Yeah,
feel of
yeah,
it
yeah.
or whatever. And then the more we started talking, I don't know if it was that same visit or like a couple weeks down the road or whatever it was, but all of a sudden, again, another light bulb went off, and I was like, you know what? Lay down on the table. Do a sit up. I want to feel your core. And she lifted up, and I literally, and this woman has a six pack, like she is fit. And I literally lost 3 fingers between
Oh,
her abdominal muscles. And all of a sudden I was like, oh, I literally looked at her and I go, oh, I found your problem. Like your hips are not supported because your core is so separated. And then we started talking about incontinence. Like that was never something that was brought up about, her at our Botox appointment. Like we didn't talk
right.
about that, but now all of a sudden we're talking about it. And so, anyway, with that being said, she to this day, she completed all of her series and then does not miss
So she
her
did core to
maintenance.
floor. It sounds like she
She
did core
did
to floor. Okay.
she did core, yep, she did core to floor, and then we continued with maintenance. And so maintenance is again very subjective based on where the patient is starting and where they want to go to as far as their results go. But we see her at least every quarter for one of the treatments. Sometimes it's a little more frequently depending. And then
Sure.
she's also been somebody that has strengthened her glutes and done other treatments, and more or less because those were more for cosmetic results, but she may be getting, some support from that as well.
What happened to that separation? Did it slowly
Oh,
close over
yeah.
time or
You
yeah?
totally
Yeah.
did. Totally did. And so what we use that for is truly a guide. It's quantifiable really because I can test it, I can document it. And so we base her maintenance based on that because it's the same concept. And I have to explain this to people a lot when they're coming in more for the cosmetic results. I really explain to them you would never, the importance of maintenance is this: you would never be able to go to the gym for 3 months and keep your results forever. Like it doesn't work that way. We think it does, but it doesn't. Or we hope it does, I should say, but it doesn't. So we chat about that we really have to keep strengthening that muscle. And so that is where we base our maintenance off of and that kind of a thing.
That's a great testimony. So her separation reduced or maybe resolved,
Hmm.
and then did the back hip pain, did that go
Yes.
away,
Yeah.
or what's the
Yeah.
verdict on that?
So it's maintained. So she
Okay.
yep. So she still does her chiropractic. She still does her massage therapy. But this was like that little icing on the cake, so to speak, to
Yep.
really get her to a place where she can live her life and feel really good about it. So yeah. So
Yep.
yes, definitely. But again, it takes time and commitment for
Hmm.
sure. And that's something we have to discuss up front. It doesn't just happen, fix itself, and move on. But it definitely maintains her and makes her feel good.
And speaking to any postpartum moms listening, I've mentioned this, I've done another podcast on some of these services previously with Natalie Schroeder,
Hmm.
and I shared this then. A lot of my listeners know, but I purchased this equipment when I was pregnant, which was quite the risk because I couldn't demo it myself.
I
But I
remember
did,
that.
but I did demo, well, my husband Eric got to demo Emsculpt. He didn't demo the Emsella. We just bought that one, but he did.
We're like, we're gonna
Actually,
go.
my mom might have demoed that. But
Hmm.
my husband did demo Emsculpt Neo on his abs, and he has always had back pain, and he does need to lose a little weight around the middle. But bottom line is, he doesn't have a strong core. And the next day he woke up and his back pain was just gone. And he was like, whoa, and that
Hmm.
because we make these decisions for larger purchases, at the clinic together, because he's our office
Hmm.
manager, that sold him. He's like, oh, we can do this. This is gonna,
Hmm.
this is gonna
Yeah.
sell because it helped him. And
Hmm.
so, and which he needs to, if he's listening to this, also get back on the equipment because, like you mentioned, if you're not doing maintenance, guess what? His back pain comes back. So he's another good testimony, which again, we've shared his story. And then myself, I was very looking forward to finally being postpartum out enough that I would get clearance from my OB-GYN to use some of this equipment. And I just felt I had a very rough delivery, C-section, postpartum hemorrhage, had blood clot. I mean, I had lots of complications. And so I was very weak because I wasn't doing much. I was on blood thinners and whatnot. When I got off the blood thinners and I got to finally use Emsculpt Neo, I felt like, whoa, like my abs are back because I had nothing there. I
Hmm.
mean,
Hmm.
after having a baby, some women like you can't even do a one sit up. Like you just feel like that
Uh-uh.
recruitment, that engagement is just not there. And
For
after
sure.
one session, which there was high anticipation for this because I had waited so stinking long, I finally got to use it myself. But after one session, I just felt like, oh my gosh, like it revived. It was like it woke up sleepy, weak muscles. It was amazing. So
100%.
for postpartum mamas, I mean, this is something I wish I would have had with my first, child. It took me so long to get in shape after having
Mhm.
him, but now we have this, I'd like to call it a secret weapon. So
It
if you're
is.
listening, yeah, this is a great tool. Both the quarter floor, so the Emsculpt Neo and the Emsella are two tools that you could certainly use. So good testimonies there. Okay, what else? What other devices do you have that are very popular? Yeah,
Yeah, so we went from the Neo and Emsella to the Emtone, and my purpose for that was leaning more on cosmetic results. And so the
sure.
patients that were doing the Neo, we could do that to strengthen. I don't think we mentioned this previously, but we can strengthen the core, but we can also do the glutes, we can do the thighs, we can do the calves, we can do the arms,
Mm-hmm.
and so those patients also have other skin concerns and fat irregularities
Larry's,
like
yeah.
yes,
Cellulite, yeah.
absolutely, cellulite, amen. And so we started to really think, gosh, we could make our neo treatments even better because again, the power of combination therapy if we
Yes.
added the Emtone treatment. And it's not necessarily that the neo cannot be a standalone. It 100% can. It just depends on what we're trying to treat and what our desired results are.
Exactly. Back to what the patients want. Yeah. Yep.
Absolutely. So then the M-tone came into play. And again, just a huge testament to BTL and their science behind their devices as far as the reason why we wanted to keep going with their devices because we just had such great results and great support that we're like, we might as well just keep on going. So we bought the M-tone. So again, working on cellulite in that regard. So it's not necessarily dissolving fat, but it is like smoothing it out
Smoothing.
so that
Yep.
yes, so the
Yep.
tissue is so much smoother and to the eye, I should say. And then it also is repairing the collagen and elastin on the surface of the skin as well. So skin tightening in that regard. And then we decided to go one step further in skin tightening and purchased a non-invasive device. At the time was called Exelis. They have now changed their technology and we have now upgraded to the Exion. But at the
Sure.
time it was Exelis, and it worked both on non-invasive skin tightening, so radio frequency and ultrasonic skin tightening for the face, as well as an applicator for the body. So not working on the muscle, working more on that surface tissue and skin. But we went that route to add another piece to the puzzle. And then that was all within about 6 months time. And then about 6 months after that, I know that's crazy. About 6 months, I wasn't fearful of anything at that point. I was like, this is so fun. And about 6 months later, I was actually approached before the device even came out, but the M-Face device.
Mm-hmm.
And it hadn't been launched. I didn't get to try it. I had to purchase it on a prayer, basically, that it was going to work. But I was the first in the state of Iowa, the first nurse practitioner, I think, in the nation to purchase it.
Wow,
And
congratulations. Yeah.
yeah, and I will tell you, rewind like a year when they asked me to purchase Neo, like if that would have been in-face, I would have bought it in a heartbeat because I was doing facial aesthetics, and so
Right.
it was
But
a
they didn't have it. Yeah,
no-brainer.
yeah.
Yeah, they didn't have it. So it was a no-brainer when they brought InFace to me because I had already had a full year under my belt with the other devices and super happy and great patient results. And like I said, changed the way I was practicing as a nurse practitioner and changed the way I educated my patients, and like all the things just kind of evolved over that year. So InFace was a no-brainer, and I will say it's our favorite because back to the structure of the face and all the things it's working on the muscle and the skin and ultimately the fat because the fat is moving up with the tightening of the tissues as well as the muscle shortening and tightening. And so with that regard, like it's our also our secret weapon, I would feel like for the face because patients, I really think the aesthetic world is like changing in the fact that most people, especially in the Midwest, but I think really nationwide, honestly, people want to look natural. People want to look like themselves, just a more rejuvenated, better version of themselves, so to speak. And obviously that's very subjective on like what people want. However, I feel like M-Face really just holds true to like making those outcomes a reality for patients and really working with what they have, just making it
Yeah.
look more rejuvenated and youthful.
Yeah,
So.
yeah. I want to break each of these down. So I actually should have asked back when we were talking
Yeah.
about Emsculpt Neo and Emsella,
Uh-huh.
like how you
Yeah.
describe how this feels to patients. So for the listener,
Weird.
weird. I know that's what
Yeah.
it's
Yeah.
intense, not painful, weird, almost like a tens unit on your, another region.
Yeah.
Like,
Yeah.
yeah.
It's so true. And speaking specifically for Emsella,
Yeah.
I know because patients are like, how do I know if I'm in the right spot? And like right when they say that and they're scooting around to find it, and right when they say it, they just kind of giggle. And I was like, we're there. Like
Yep,
you're
yep,
there.
you're
You
in the
know it.
spot.
Like,
Yeah.
yes. And then each time after that, it's like you're gonna know because you felt it before. So with that being said, yeah, it's just with all of it because it is working with magnetic energy. With that being said, it's weird. It's involuntary movements, especially
Mm-hmm.
like with the Neo and the M-Face, like well, and the Emsella, like your body's not doing that. And I think what's important, and I say this to patients all the time, your body can't do that. Like your body cannot physically contract the way this machine contracts for you. So like with Neo, for example, we say it's is it 20,000? I get all the
Yeah, yeah,
numbers
yeah. I do too.
mixed up, but 20,000 contractions. And I'm like, that's not 20,000 sit-ups. That is just 20,000 muscle contractions on a level that your body couldn't do.
Yep.
And another thing, I'm kind of switching all around, but another
Yeah,
thing I
that's
say
okay.
with the Neo, especially with patients that have that abdominal separation, I tell them next time you do a sit up, think about what that muscle does. When you do a sit up, your muscle separates. It doesn't come back together. So Neo is bringing that back together. It doesn't mean that sit ups can't make your muscle stronger, but it's not bringing it back together. Like you still have that separation when you come up from a sit up. And
Sure.
so I talk to patients really about that. It's like your body you can't physically do that on your own. So if you really want something, there's two options. You can go to a surgeon and have them plicate the muscles. We can sew them together. The problem is then they're going to tell you you can't work out for 3+ months, right? So then you're losing your strength, but your muscles tight, right? Or tied together. So the nice thing about Neo is it's non-invasive. You can literally come here, do the treatment, walk out the door, go to the gym. Like there's no downtime in that regard. And it's working on that support, that core support, to make everything else, like I said, work better.
Yeah,
So
now that we have all these devices too, I can't keep all the stats
I know
straight, but
it's like
if I remember
11,000. Yeah.
22,000, whatever.
Yeah.
But thank you for saying that this is inducing super physiologic muscle contraction. So even for those super athletes like yourself, marathon runners, triathletes, right, who are clearly working out, oh, I don't want to say like to their, I don't know if I'm saying this right, to their max, like they're working very
Yeah.
hard.
Yeah.
Even Olympic athletes, right? This equipment can still take them to the next level because I think when you exercise, you can only, again, what are the stats? Get your muscle to 60 or 80% of its capacity, but
Right.
then using this equipment, we can get you to 90, 100%, whatnot. So
For
it
sure.
is important to know that this equipment can take you to the next level. We keep saying secret weapon, so I think we'll just say all the equipment
It is. It really is.
can
For
be a secret
sure.
weapon. So then let's go to Emtone because that was the next device you got, and we recently got this one as well, and I was super
Yes.
excited because I also have some cellulite, and so I need to work on that. And there are root causes of that, and obviously fat loss can help, right? So I've been using
Mhm.
Emsculpt on my legs, but
Mhm.
I've had one Emtone treatment. I need to do the full series, but I gotta get that scheduled on my schedule. So
Right.
Emtone is interesting to me because out of all the treatments, I feel like Emtone is the loudest. Well,
It's
because
like,
it uses pressure and ultrasound, so it's almost
yes,
like down your legs. I don't know how to describe it.
you
It
can hear
doesn't
it through the whole
hurt.
building.
Yes, literally,
Yeah.
yes.
Yeah. It's like
So it's the
you don't want to
little,
schedule a facial while we're doing an Emtone treatment down the hallway because yeah, it's loud.
a little distracting. It
Yeah.
doesn't hurt. It's just very different. So,
Mhm.
but has this been, like you said, a popular treatment that you're pairing with Emsculpt Neo then with, right? So,
Yeah. Yep. So Neo, and then also it kind of depends. Like, so for cellulite specifically, so like if somebody is coming in, we use Emtone kind of twofold. So we use it truly for its use, its purpose, which is
yep.
cellulite. But again, like you said, cellulite is a beast. Like cellulite is it's not cellulite's not going to go away per se, but we can get you like a level better, is what I always tell
Yes,
people. So I have
yes.
a picture and I show them, like, if you're sitting down and you see the cellulite, then when you're sitting down, you won't see it, but you might see it like if you're squeezing your leg or something like that. So we chat about the different degrees of cellulite and then
Yes.
also why do we have it. So I hate to, or I shouldn't say I hate, but I don't love always blaming things on genetics, but some of it is. So like in this regard, genetics definitely does play a role with fat distribution and things like that. And then being a female versus a male, that also is part of it.
Huge. Yeah, men usually don't get
Yeah,
cellulite.
no, they don't. And so, darn it.
Yep.
And then the other thing is it's a tethering of like the fat to the skin. So that's where you're seeing that dimpling and that rippling. And so what Emtone is doing, like I mentioned previously, it's not dissolving per se or getting rid of the fat or causing fat
Lysis or
apoptosis or
whatever. Yeah,
any
yeah, yeah.
or
Yep.
yep, lipolysis, none of that. What it's doing is it's smoothing out the surface. It's smoothing out that skin, it's smoothing out that tethering. That's where the pressure comes into play. And I mean, it sounds like a jackhammer. Like that puppy is moving and grooving and doing the things, and it's kind of a messy treatment, but it truly for the right patients. And again, that is something that I talk also very in depth with, this really setting realistic expectations and limitations with every treatment, but Emtone especially. I feel like we really have to paint a very realistic picture of what we expect it's going to do and what its purpose is. And so really talking about like how it's going to smooth things out, not
Hmm.
necessarily take away the fat or and things like that. So we're not expecting inches to be gone or anything like that. The other thing that we use Emtone for is actually to break down, and I never even thought that we would use it for this, but we have, and it's been wonderful. Um, in this case, we do pair it with Neo on the abdomen in people who have had extensive weight gain at one point and then weight loss or babies. And I've done this on men and women. But in the effect of their tissues are just that tissue that was stretched out and overweight and those kind of things, or stretched out from pregnancy or whatever it is, those tissues are never, they're not the same. They are not
Sure.
normal soft tissues. A lot of them are very fibrous tissues. And so, in order to get other treatments, either microneedling or other skin tightening or neo or anything to work really well, I have found using Emtone to break up some of that adhesion, honestly,
Mm.
or that fibrous tissue has really made, and again, probably not on label, it's just something that's really worked well for us. A great example, I have a couple of, or a lot of them, but a couple of them that come to mind is one is a male patient who was in a weight loss journey and losing a lot of weight, and he was working out, and he would do a sit up, and the man was strong. Like I could feel it. You just couldn't really see it. But like when I felt his tissues, everything just kind of felt, I don't want to say hard, but like thick, I guess is a good way to say it. And so we used the M-tone along with Neo to just really smooth out the surface of his abdomen and break down some of that more, I guess, fibrous tissue is
Yeah,
the word
yeah,
that I'm using,
yeah, yeah.
and really made a huge difference for him. So I don't know if it was just from the weight loss or exactly why his tissues were like that or genetics or what it
Yeah,
was.
yeah.
But anyway, for him, that was his case. And then we also have kind of a couple of fun stories, but one of them is a gal who knew she was going to get a surgical procedure for her abdomen. She was going to get a tummy tuck. However, she wanted to tighten her core a little bit before. And so when I was doing the assessment or whatever on her,
Intake.
we
Yeah,
also,
yeah.
yeah, yep. I also like I just kind of felt her tissues, and she had already lost a ton of weight previously. She had had babies, and her tissue, her lower, like her pannus, her lower abdominal area with extra skin was just thick. Like it just, you could tell it was just not quote unquote normal tissue. And so I talked to her about kind of breaking that up a little bit as well with the M-tone. So we did a series of all of it. And I mean, this
Yeah.
is a different scenario because she knew she was going to have some of that tissue removed, but it was so cool when she came back to me for another treatment that she came to me for after her surgery. And she goes, the surgeon specifically said to her that he believes that the Neo tightening her core,
Mm-hmm.
as well as breaking down some of those adhesions in that fibrous tissue, made her recovery and her results so much
It
better
made his job
because
easier,
that,
made the surgery
yeah, it
better
made
in
it,
general. But
yeah,
yeah, but then the
yes,
recovery also. Yeah.
absolutely. So, I mean, and obviously that's not the scenario or the route that everybody could or
Right.
would want to
Right.
do, but the fact that it had that effect was really cool to me. So
Yeah.
anyway, so there's
Well,
lots of
thank you
different
for
uses.
yeah,
Yeah.
thank you for sharing. So for the listeners also, so M-tone treatments for cellulite are twice a week for 2 to 3 weeks.
Mhm.
So I got to get that again on my schedule. So that's the frequency of those. Emsella is twice a week for 3 weeks. This is just the initial, not the maintenance, but
Yes.
the initial. And then
Yep.
Emsculpt Neo is once a week or once every 5 to 10 days. Because we also,
Mhm.
I forgot to ask. I mean, not ask, wait. We forgot to mention that. So just for the
Yeah.
listeners. So, okay, what about Exion? Let's go back to Exion. Because this also can tighten skin as well, and this can be used on the
Mhm.
face or the body. And we also recently purchased this, can also plump the
Yeah.
limbs. I mean, it has a lot of fun uses. So,
Yeah.
um,
Sure.
I think of this as more, I literally have never, I've been very transparent with my listeners. I aged a lot this last year having a baby over 40. Like it really, it's been a hard year.
Yeah.
I mean, I feel like it's showing also on my face. I have more wrinkles, whatnot, but I've never put anything in my face. I've never done Botox, fillers, nothing.
Mhm.
So I was excited to get this equipment because I want to see what it can do to my
Yeah.
face in the absence of
Yeah.
having tried other things.
For sure.
Um, and I also haven't scheduled those for myself. I mean, I've tried them, but haven't done the full
Hmm.
series. So
Yeah.
tell me like who a perfect candidate is for Exion, kind of what their goals are, what you're hoping to achieve using that device on the face and on
Yeah.
the body.
Yeah. So, well, I should also mention, so, and I don't know, Stephanie, if do you have the RF microneedling too?
No, but that I was on
No.
my list to ask you. No,
Yeah.
I started just with the
The
M
non-invasive.
face and the yeah, yep, yep, and
Okay.
the Exion body
So,
and hand or
okay.
face piece. Sorry, body and face piece. Yep.
Okay, so prior to purchasing anything from BTO, prior to Neo, prior to anything, we had a different RF microneedling
Sure,
device.
sure.
And so utilized it a ton, utilized it all the time. So basically, two forms of micro trauma, I call it. The needles are doing one form, which tells the body it needs to heal, so causes new collagen and elastin. And then the heat can at deeper levels work on the other tissues, the skin and the fat below the surface, and so can be used on the face and the body. So that's what we utilized prior. Then, when we purchased the Exilis and now upgraded to
Yeah.
the Exion,
Yep.
we were able to truly utilize that form of skin tightening with the one type of micro trauma, I call it. So the heat without needles. And I love to use it in more delicate areas like around the eyes and around the mouth because microneedling, while it has a wonderful place around the eyes, I'm going to give you a black eye for probably 3 weeks if I do a really good treatment on you. And lo and behold, patients don't love that. I don't love that. I don't need you walking around being my billboard with big black eyes. So, with that being said, we love to use the Exion, not microneedling, but the non-invasive handpiece for the face in delicate areas. That's where we utilize it the most, I would say. And we absolutely strongly recommend and encourage you pairing it with Emface
Hmm.
because if we are, I call it like kind of the works treatment. They're basically getting their cheeks and everything lifted and tightened with the Emface, working on the jawline, can work on the forehead lines and wrinkles. But then also if we're pairing that with the Exion device, it's tightening the tissue around the eyes, helping with some of that laxity to the upper eyelid tissue, and then also combining or complementing the area below the eyes to just kind of really mesh that together again so we don't have that deep trough or that deep hollowing where we see all those dark circles basically from the light reflex and all the things. So it just complements each other very well when we put them together. Not that they can't be done separately. They
Separate, sure.
totally can be, but again, combining them, we really love to see that result for sure.
And coming full circle to what I was trying to say earlier that I didn't come back around to was
Yeah.
so for patients who don't want to put needles in their face, like I hadn't put needles in my face, the
Yeah.
combination of the M face and the Exion face could be that
Hmm.
non-surgical needleless facelift, could
Absolutely.
kind of provide that.
Yes.
So, but again, I mean, highlighting just how the therapies complement each other is really important. So, Exion more, yes, for like skin tightening, right? And
Uh-huh.
stimulating
Yep.
collagen elastin production here on the face, but you can also use the body piece on the body. So even we've had
Hmm.
patients, well, I used it on my inner knees because I had just a little
Hmm.
fat right on the
Hmm.
inner knee is what I would call it.
Yeah.
I've used it there.
Medial knee.
Yeah, medial knee. You can also use it on your belly as well.
Hmm.
So if patients
Hmm.
under that C-section have a little pooch or whatnot, a little fat there that
Yes. Our
that
favorite.
Emsculpt Neo can help, but the Exion body can also help to kind of tighten the skin there and get rid of some of that fat. But the Exion body can be used on locations that we can't do Emsculpt Neo also. So even like bra fat, back here, just really, I don't want to say anywhere on the body, but there are more locations we can use it on than we can
Yes.
use Emsculpt Neo.
Absolutely.
So, yep. So let's go M face. And
Hmm.
and well, back to Exion. So as far as how that sounds and feels, it's just warm. It's almost like a hot stone massage or I
Yeah.
mean, I get warm pretty easily and it is pretty warm, but we want the heat
Hmm.
to tighten the skin. So that's kind of
Hmm.
how it feels for patients.
Hmm.
Um,
Absolutely.
but then let's go to M face. So what does
Yeah.
that feel like?
Yeah, so that is another one that I just truly say it's going to feel weird. So we also in our clinic when we educate on it, we show a video because I think sometimes people have a hard time like wrapping their brain around what does this applicator do
Hmm.
and where are you putting it and what is it doing? Is it my whole face? Is it a mask? Like what is it? And so we love to show
A good
just a
idea.
little video that the one that we have is I should mention, so M-Face can go on the forehead, the cheeks, and the submentum, so the area under the jawline. There's a new applicator coming out that we don't have yet, but it's coming to support like the under eye area as well, which will be wonderful.
Hmm.
Um, but with that being said, it's addressing the areas of the face, but it's not hitting obviously the whole face like a mask. But when I first purchased M-Face, the only applicators were the forehead and the cheeks. So we didn't even have the submentum yet, and definitely not the under eye. And so now the video we have is just the forehead and the cheeks. But in the future, it would be nice to kind of show
Yeah,
because
yeah.
the cheeks and the forehead feel a certain way, and then the jaw is a whole different ball game. So
The chin's
the
spicy, as Heather likes to
oh,
call
it's
it. It's a little
spicy and
spicy. Yeah.
yes, we it kind of feels like you're getting the muscle drilled up a little bit, I would say, but
Yep.
also but not like a painful drill. It just is like a little tornado, somebody said. And I was like, like yeah, a little chin tornado. It's absolutely like that. But it also, I had another patient say, "Well, that feels like success." I was like, "Yeah, it really is," or progress,
Well,
or
it's
something
unique
like
because you
that.
normally aren't working
Yes,
this muscle, right? So for
no,
the listeners, what we're talking about is
yeah,
an applicator that can get rid of a double chin, like literally. It's
it,
so
yeah, because
it is a weird feeling because normally you're not like working that muscle. So like when you actually feel it contracting, it's interesting.
absolutely.
Yeah.
And like I think something to be said about that is there's no other treatment like in the aesthetic world anyway, or in the non-invasive, non-surgical aesthetic world that's truly working on that. The digastric muscle under the jawline, over time, that muscle also sags and droops. And so I can have people that come in that are 100 pounds soaking wet. They don't have an ounce of fat in that submental area or that under the jawline area to say they have a double chin, but they kind of look like they do and they don't love it
Good.
because that muscle started to droop and drop. So
Sure.
this is tightening and pulling back, kind of like a sling essentially to
Yeah,
get
that's a
that
better way
muscle
of describing it
to
then. Yeah. Yep.
yeah
Yep.
to tighten that back up. And then again, it's working on the tissues, and the fat follows that obviously when things get tightened up, and then can dissolve some of the fat in the area that we want to under the jawline. So
And this is just a 20-minute treatment, but kind of like Emsculpt Neo, how we say come once a week for 4 weeks. This is
mhm.
from a same frequency standpoint, come once a week for 4 weeks if you're in your 40s, if you're in your 50s, for 5 weeks if you're in your
Yeah,
60s, for
yeah,
6 weeks if you're in your 70s. It might take a little longer,
yeah,
but it's
for
only
sure.
20-minute treatment, and you can we can apply two applicators at once. So you can do the chin and the cheeks, or the forehead and the cheeks, or the forehead and the chin, or whatnot. We can do
Hmm.
two at
Hmm.
once, just so the
Hmm.
listeners know that. Yeah,
Hmm.
eyes to come. So then what are we gonna do? Can we do two back to back?
Yeah, exactly. Yes, absolutely. That's exactly right. It's just you want to do it all for sure.
Those are all the devices that we currently have, other than the RF microneedling. Do you have the other device? I already forgot what it's called, or the
The new
M-Fem,
one.
the M.
Oh,
Is it?
infant. Yes,
Yeah. Do you have that one?
actually.
Yeah.
Yep. We actually have recently brought that on, and actually kind of soft launched it to patients in house. We haven't done like a big launch of it yet, but I do believe in that as obviously. So Infim is working on basically the female tissues to really help tighten any laxity of the labia, and to really help even the um, how do I want to word this? So basically tightening and helping with lubrication in the
Sure.
female genital
Yeah. The
area.
vaginal
That's
vault. Yeah.
basically,
Yeah.
yeah, absolutely. Exactly. And so with that being said, it is an intimate treatment. It is performed by a female provider, absolutely. And what we do notice with that though is after 1 to 2 treatments, patients are truly noticing, especially the internal treatment.
Yeah.
We can
Yeah.
do external treatments to help with more of the laxity of the tissues, but internal for lubrication purposes, patients notice a pretty big change within 1 to 2
Wow.
treatments. And that's huge for women. I would say perimenopausal, mostly where we just start to notice that, yeah, things are just dry. Like everything just kind of dries up
Gets
after a
fragile
while.
and
And
yeah.
so,
Yep.
yeah, absolutely. And you can speak more on like the hormone side of
Yeah. Yeah.
things
Yeah.
than I
Yeah.
could, but definitely it plays a huge role in that. And so what we love about that, again, since it's an intimate treatment, we really like to just bring it up kind of more on an individual basis based on what patients mark on their concerns, based on other treatments they've had in our clinic. But it's lovely, and it's definitely not painful. I've had it multiple
Sure.
times on myself, and it is
Sure.
not a painful treatment. It is very much not even. I feel like it's very easy to get comfortable with it. It doesn't feel like you're getting a pelvic exam. Like it's definitely tolerable. It's a warm treatment, kind of like the other devices have heat involved. We use lubrication, so it doesn't feel any friction or anything sore whatsoever. But yeah, it's definitely it was a missing piece in our clinic that I didn't even know that it was a missing piece. It was something that I was just like, well, I'm buying everything. I might as well add it on. And now I'm so glad we have it because we have been able to offer it to people that you just, like I said, it's not something we talked about before, but
Hmm.
it's definitely a need and a desired treatment for a lot of people.
Sure. You've already answered a lot of the next questions I was going to ask. So let me go back
Yeah.
to, I mean, kind of discussing, I want to come back to maintenance too, but also just how do you set the right expectations and the limitations
Mhm.
of these services with patients?
Yeah. Yeah. So, although these are all backed by science, the treatments that we offer, it's not always an exact science and
Right.
everybody is different, right? So, I just really, I try to explain it kind of in a quantifiable way as far as like this, we can make 20% improvement or we can make a 20% tighter abdomen or, like
Sure,
that. But
sure.
what does that mean, right? Like, what does that mean to people? And so I just explained to them it is a non-surgical result. So we have to think of it that way, but then also we have to think of it of how long are these treatments going to last if we
Back
only
to
do it one or
maintenance.
two times?
Exactly.
Yes,
Yeah.
back to maintenance. So that's how we do it. We just address it up front. Like I said, I always talk about not one and done. It's consistency, it's commitment, it's a lot of times combination therapy, it's always maintenance. And so on the very first visit, when somebody comes in, one of the very first things we talk about when we start honing in on specific devices and specific procedures is what does that look like long term as far as from a maintenance and a time frame standpoint as well as a budget standpoint. And I will straight up say to patients, and I say this in the nicest way, but I say if you don't feel like committing to maintenance is something either from a budget or a time frame
Right,
standpoint
right,
is
right, right.
something that you're going to want to do, then do not purchase this treatment up front because you're not going to be happy. Like you're going to be very disappointed because these truly do take time and commitment to get the best results. And
Yeah.
so like I think so
You're
that
pretty
probably
frank.
answers
That's good. Yeah.
yes, that probably answers your question better. I don't sugarcoat it, and I'm very honest
That's
with
good.
that
Yeah.
because I always say and the reason why somebody would not be happy with the result in most cases is because I didn't give them all the education up front to make an informed decision on if that's truly the result that they wanted. Or my team, like maybe I didn't educate them enough to educate my patients enough. So that I put that on my shoulders because I have seen time and time and time again these results just blow me out of the water of the quality of life changes for patients, the cosmetic changes for patients. But it's because those patients believed in the treatments and put in the time and the effort to make them work the way that we expect them to. So yeah, so I definitely am very passionate about education. That's how we do it.
Great. Okay. So obviously you mentioned you're an athlete, you're this marathon runner. So what is the favorite device that you personally use if you're comfortable sharing that? Like, are you using Emsculpt Neo?
Yeah, so
You're
I have used it. I'm not currently using it, but I have used it in the past because it's wild. Like you would think I am fairly fit, and so I do a lot of times think, oh, like I don't necessarily need that or I wouldn't need that, but it's crazy. I was having hip pain and I was having back pain and I was having those things, and it's like, and I should back up. I have had a baby, but I had a 2 pound baby, so it wasn't like
Oh, yeah.
I
Yeah. Not a
in
10
15
pounder.
years.
Yeah. Yeah.
Yes,
You're a
and
small
15
person
years ago.
also. Yeah.
Yeah, 15 years ago. So I can't blame it all on her for sure, but I can blame it on how I've put my body through it over the years with just being, like you said, an athlete and trying to see what I am capable of, basically. And so, yes, so Neo definitely, Emsella definitely in the past, because as I
Yeah.
have more
Yeah.
birthdays, I notice holding the urine is difficult at times. But one of my favorite, well, see, it's hard because I'm like, well, all of them, but one that I would say I love the kind of like the first like 48-hour results and then obviously they build on each other, but our microneedling device, our RF microneedling for the face, I just love the glow that it gives. With that being said, obviously the long-term results of the non-injectable option of face is great for rejuvenation of the face and things like that. So it's hard to pick one, but I would say if I had to pick one out of all the treatments I do, I love a good RF microneedling treatment.
Sure.
I just think they're super fun and well, not fun. They are needles, so they're a little
Yeah. Yeah. Yeah.
uncomfortable, but we make you comfortable. We have
Yeah. Yeah.
ways
Yeah.
to do that. So anyway,
Well, speaking of needles, for patients who are getting neurotoxins, fillers,
yeah.
whatnot, which I'm sure
Hmm.
you have a lot of those because you offer those services as well, if I
Hmm.
remember right.
Yeah, for
Is
sure.
it okay to combine these? And if so, in what order and how do you do
Yeah.
that? If you can
Yeah,
answer that quickly. Yeah.
yeah, I can answer it really
Yeah.
quickly.
Yeah. Yeah.
That's actually one of my favorite questions to answer. Like I mentioned in the beginning, I think kind of working from the ground up. So we really want to support and build everything back to where it needs to go. And I think 95% of the time, starting with especially dermal filler is not the route that I recommend, because if we want to get that canvas looking better and we want to get that muscle better supported, filler cannot do that and is not going to do that. And so in most patients, I would say maybe the 32-year-old to maybe 36, 37, that's a generalization. Maybe every once in a while they have good skincare regimen, whatever it is. We could potentially add a little volume with dermal filler to help with that kind of facial volume loss that they have and they're noticing under their eyes. But like I said, that's maybe less than 5% of my patients. So I use filler to answer that question. I use filler as a complement, not as a primary procedure. So it's almost
Good
like
answer. Yeah.
a very last, I don't want to say last case scenario, but in a lot of cases, it's the last part of our treatment plan. So when you come into our clinic, we
Yeah.
build a treatment plan and it's often on there. However, it's definitely not a first line of treatment in most cases, um, as a recommendation, I should say. So
Yeah. Good answer.
again,
Yep.
and that's I think just based again on limitations and expectations of what we're going
Yeah.
to get out of it. I think in the lovely world of social media, we see a lot of things that we think it's just or on the news or on like TV or whatever, we see actors and we see celebrities and influencers and all the things, and we think, oh, for sure, the only thing they ever had done was they got their lips done or they got their cheeks done or something. But in most cases, that's
Yeah.
not reality. They've had a lot of other things done, maybe microneedling, maybe face,
Or a facelift or yeah, other
maybe
things.
a facelift, absolutely, maybe surgery,
Yeah.
absolutely. So it's like that just paints a little piece of the puzzle or picture, and so we have to like kind of dissect that a little bit during our consultations, and yeah, be realistic, I guess, paint those expectation or realistic expectations and that kind of a thing.
I'm gonna put you on the spot, although you can't really see my
Yeah,
skin over the computer. The computer
yeah.
is making me look a
Well,
little orange.
and yeah.
But I have pretty bad nasolabial folds. So my hope is that if I do M face, it's gonna lift this.
100%.
It might not eliminate them, but I think I just
Yeah.
need to do not just start with M
Yeah.
face, and then I was gonna do
Mhm.
Exion face right around
Yeah.
here. I'd like to do
Mhm.
my lips as well, but so if I had come to you as a patient, which I should come to you as a patient, but I have these at
Yeah,
least
I would
these
love
devices myself. So
that. Well, we could trade. I need to come to you for some things too. So
there we go.
perfect.
Do I have realistic expectations for myself that those would be appropriate treatments given the concerns that I have?
Yeah, absolutely. Ideal candidate, to be
Yeah,
totally honest.
yeah,
So, what I talk about with patients is, because yours, from what I can see
yeah,
from
yeah,
here
yeah.
and what I think I remember from in person, your canvas, your skin is preserved. It looks good. You
Sure.
take care of yourself. And so, with that being said, I definitely feel like just starting with M-Face would be an excellent option just to help really, again, giving that lift and that tightening, and sending
Hmm.
things back north instead of how things start to push down south. So yeah, so I would say definitely in that regard. With that being said, if somebody comes in and they've had maybe a few more birthdays than you, maybe they're in their fifth or sixth decade of life, and they've also had some environmental exposure between the sun and whatever over the years, and their canvas is just a little bit more weathered, I guess you could say, just a few more fine lines and wrinkles and texture changes and pigmentation changes. Like we at that point might be talking about either esthetician services to just help
Yeah, yep.
hydrate and moisturize and then pair it with products. Do start that first, and then I'll reevaluate you in 3 to 6 months, like see where we're at. So it just really depends, because I, again, painting that realistic expectation of it's not a one and done situation in some cases. And so we really have to think about like what's the best like starting point. And so that's again all part of that treatment plan, that we make when they come in for that initial consultation. We spend about an hour of time with them just to truly develop
Mhm.
a great plan, but a
You have
realistic
so many,
outcome
and you have so many tools. Like it takes
for
that
sure.
long just to mention all
It
the tools
it truly does. It
that you
truly
have. Yeah.
does.
And speaking of tools, I know we're at the end of our interview here, and we could probably do a
Yeah.
whole episode on skincare, but is there anything that you quickly want to mention that you love recommending from a skincare
Yeah.
standpoint or skin routine standpoint?
Yeah. For sure. So one thing that I strongly encourage when patients, so it's not just one product, right? Because obviously we all need something different or a different regimen. But what I do say is a couple of super important things to touch on is if a patient comes in and there's only one thing they can do, like from a budget standpoint or whatever it is, I send them out the door with skincare all day, every day, because they're getting, if they do it, they're getting it on their skin every day. I'm seeing them maybe once every 4 to 6 weeks if it's an aesthetic procedure, or my team is. So
Sure.
with that being said, it's number one. I mean, an SPF, like if we just have to pick one, we're going home with an SPF. Like that's where we start. So skincare is huge in that regard. The other thing is medical grade, good quality products. And what I explain to patients is you're going to go to department stores, wherever you go, drugstore, and you're going to find the same names on those bottles as my bottles on my shelf. The difference is a couple of things. The price, they're going to notice it. The price is different, so I don't sugarcoat it. But the reason why the price is different is those products are scientifically formulated to be able to absorb through the surface of our skin. The ones that the
Walmart.
drugstores or wherever, Walmart, Walgreens, Target, wherever, Ulta, even Ulta and Sephora, even those are a little pricier. Those products typically just sit on the surface of your skin. And if you have good skin and you're not coming to me for a concern with acne or pigmentation or fine lines and wrinkles, you don't really have any concerns. Those are probably not hurting you. They're not necessarily helping, but they're not hurting you. It's the ones that come in and they have a concern that we want to treat, or the signs of aging or whatever it is, or acne in our teenage and some hormonal females or whatever it is. We really have to address what do we want those ingredients to do for you, and it's truly like prescribing a medication in a sense, because it's really those are the powerful ingredients that are going to make the change, and do a huge impact on the
It's the
skin.
same thing
So
with professional, we'd call them nutraceutical, with our
supplement,
nutraceuticals, aka
yes,
our supplements, medical grade supplements, that we want to make
mhm,
sure they're sourced appropriately, the potency is appropriate, and there are these formulations, scientific, formulations that have been studied. Like literally,
right,
we want patients to be taking the same formulation that showed in whatever study it was going to produce X, and the formulations you always
right,
get like over the counter don't necessarily match
right,
that criteria. So
exactly.
same conversation with
Yeah,
getting high quality supplements.
absolutely.
You have shared so much with us today. Is there anything else you want to
Yeah.
share? Any other patient testimonies, or any other, favorite examples of combination therapies? Anything else you want to share? Do you feel like you've given us a lot?
I think I kind of nailed it, like with all the things. Yeah, I actually do have a fun story from, and not necessarily combination therapy, but an Emsella story. And I think actually I might have showed this testimonial at one of my
Yeah.
talks that you maybe heard, Stephanie, but. It's a gal and her husband, and I consider them together my patient, because she is a wheelchair bound MS patient, and they love to do things together, but it really got to a point where he couldn't even take her an hour away because they would have to stop at a public restroom. And well, he's a male and she's a female, and a lot of times he couldn't go in with her, or those bathrooms just aren't, even at restaurants and gas stations, a lot of times designed for a wheelchair and another body in there. And so they just kind of got to a point where they just couldn't go because she couldn't hold her urine for an hour.
Yeah.
Same thing at night. She couldn't get out of bed without having an accident because she couldn't get there quick enough. And her husband heard of us through, well, I think he knew of us, but then knew of me on a personal level. But he also heard of us through we had a BTL bus come a couple years ago, and he came and he learned about it. And I think I think Anna, our practice manager, mentioned to him, well, we have him Emsella, and kind of started talking about it. And he would just all of a sudden was like, my wife needs to try this. And that was, gosh, 2, maybe 3 years ago now. And we have tailored the program exactly for her needs to keep her at a point where they can now drive 2 hours away to Des Moines to go to a concert. They can drive to Clear Lake 2 hours to go to a concert. That's something they love to do as a family or as a
Mhm.
couple. And I mean, right there, if that was my only success story, I would call that a win, because
Yeah.
that
Oh,
changed
absolutely.
two people's lives in
Yep.
one scenario. And like,
Yep.
that's, I think, what we forget from, yes, this is an aesthetic clinic, but we have to think of it from the quality of life and the wellness side of it too. Like, it's life changing. And so yeah. So I would say that's probably one of our favorite stories, not necessarily combination
Yeah. Yeah.
therapy,
Yeah.
but definitely a
And
huge
I
life changer.
Yes, I did hear that one. That was a great story. I'm glad that you shared that.
Yeah,
And
it's so fun.
I mean, also to that point, when we purchased Emsella, at first I was like, I don't know if this is really going to sell. Like, am I gonna? I mean, I knew I had the right audience, the right demographic for it, but I thought, is this really going to be a popular ther
Hmm.
one of the most popular therapies, right, of all the
Uh-huh.
devices we have? And it
Uh,
is. It just is. Women
and it's
see
so
it. Almost
easy.
everybody has this problem. It's
Hmm.
very easy. You just sit on this chair fully clothed, and back to
Yes.
quality of life. It improves your quality of life with no pain. Like
Hmm.
so many women
Yep.
just with sneezing, coughing, they're not leaking. They can jump on a trampoline. They can run. They can
Yeah,
do
they
things
can
they
be
haven't
active
done before, and that's worth its weight in gold. So I
for
was
sure.
very surprised, but also pleasantly surprised at
For sure.
patient retention rates and success rates with Emsella. It's just been a wonderful device. So I'm
Huge.
very glad we had it. So, okay, Bethany, tell us where listeners can find you.
Yep. So we're located in Waterloo, Iowa, and we are also, you can find out more information on our website at www.spryskinandwellness.com. And then you can also find us on social media on Instagram and Facebook.
Perfect. You have great Instagram. Yes. Okay. Last but not least, what is your top longevity tip?
I think one of the things that I love to say is self-care is not selfish. Like you totally, I know I've heard that
Mhm.
before from other people, but it's so true. So really, if you don't take care of yourself, if you don't feel good, like you can't take care of anybody else. And so I think of that from a boss of wonderful women, as well as a mama, as well as a provider to my patients. Like I can't be good if I don't apply like all the things to myself. And so with that being said, fitness is a huge part of my life just for the simple fact that it makes me feel good mentally and physically.
Mhm.
And I mean, obviously, feeling good about how I look and things like that, that's always a bonus, but definitely from a mental standpoint, I always joke, but real quick if Bethany didn't work out one day, because I just really, I really hold that pretty high as far as from a stress level, and that just really mellows me out. So yeah, so take care of yourself. That's huge.
Yeah, I mean, and that's a good longevity tip to take care of yourself, but also to encourage physical fitness because when you move your body and you have more muscle mass, as also testimony to all the muscle building services we both were talking about, right? You will live
Hmm.
longer, or if you get a chronic disease or have to be hospitalized or get cancer or whatnot, research shows your outcome's going to be better the more muscle you have. So
Yeah,
you need to
stronger.
exercise to preserve your memory, but also just to prevent all-cause mortality. So
Hmm.
yes, good,
Amen.
good tip. Okay. Well,
Yeah.
thank you, Bethany, for coming on the show today and for your
Yeah.
personal encouragement and guidance to me to bring on these services. So thank you for being a pioneer for them for Iowa. This is great.
Yeah. Absolutely. Thank you, Stephanie.